Good day and welcome to Rapid Respiratory Review, and today we're going to be talking about mucolytics. So why would someone use a mucolytic? A mucolytic is used in order to mobilize the secretions and increase the fluidity of the secretions. So I know I have a picture of cervical secretions, but it means the same thing. What you're going to use mucolytics for is the thick secretions in order so it can be more fluid and then better excreted by the cilia. And we'll be looking at two different drugs today. So the first drug we will be looking at, the trade name is Mucone Mist, and the generic name is acetylcysteine. What its mechanism is it lyses disulfide bonds holding the mucopurulent secretions and mucoproteins together, thus increasing the fluidity. So when the cilia are beating, it's able to bring the mucus up and allow you to expel it with protective airway reflexes. The concentration of it is 10 to 20% weight per volume, so that would be grams per 100 milliliters of volume. The standard dose is 4 mils of the 10% weight per volume or 2 mils of the 20% weight per volume solution with 2 milliliters of water or normal saline after. The indications for it is thick retained mucoid or mucopurulent secretions. Contraindications to it is hypersensitivity. So with this, I want to make mention, when you're giving it, a patient may become hypersensitive after taking it after maybe a couple doses, or the first dose they may become hypersensitive to it. Some side effects that you may encounter: bronchospasm, excess liquefaction, and that can lead to all the other problems associated with acetylcysteine. So you can still get retained secretions, stomatitis, which is inflammation of the mouth and the nose area, nausea, and rhinorrhea. And rhinorrhea is just the excessive flow of mucus through the nose. Some characteristics of acetylcysteine is it's very foul smelling. It is you want to refrigerate it after opening if you're using it again, and it reacts with rubber, so it should be in a glass container. It shouldn't be poured into a bowl or a basin unless it's metal, of course. And you want to admin after the pre-treatment with the bronchodilator so that it's able to go deeper into the lung. Also, some points about Mucomist is Mucomist has questionable efficacy, so it's not necessarily tested completely yet, and is recommended to be given in conjunction with the bronchodilator. Like I said, use the bronchodilator and then use the acetylcysteine. Now that we've talked about acetylcysteine, now it's good to talk about another one that is very common, which is pulmozyme or Dornase alpha, which is a genetically engineered clone of the pancreatic DNase, which is a peptide that can break down extracellular DNA and F-actin polymers in purulent secretions. So like Mucomist, it breaks down the protein structure in order to leave it not in big clumps, but in more manageable fluid-like structure. So the dose you give is 2.5 milligrams per ampule and 1 ampule daily via a recommended nebulizer system. When you would use pulmozyme is best for CF management, and it's better to manage the purulent mucoid secretions, and it's more effective than Mucomist in CF. What are the contraindications? Just like Mucomist, it's hypersensitivity. What are some side effects? Pharyngitis, laryngitis, conjunctivitis, rash, chest pain, but there's also less common ones such as GI obstruction, hypoxia, and weight loss. Thanks, and we'll be talking about mast cell stabilizers next. Have a great day.